Finding Hope, the Road to Recovery.
Hi, and welcome to Finding Hope, the Road to Recovery. The episode today will be covering grants and funding for mental health and substance use disorder services, also called SUD services. My name is Michael Gutierrez. I am a Program Operations Supervisor in the Program Development Department at Tarzana Treatment Centers. And today I'm joined by my colleague, Alex Salazar. Alex, go ahead and introduce yourself.
So I'm Alex Salazar. I'm a Senior Supervisor at Tarzana Treatment Centers. I've been running grants there for about 10 years now. And yeah, that's me.
All right. Thanks, Alex. So today we will be discussing the importance of public funds and grants for nonprofit agencies like Tarzana Treatment Centers and the impact of these funds and grants in the agency and in the communities that we serve. So we're going to do this in two parts. The first part, I'll be asking Alex a couple of questions, or more than a couple of questions, about what are grants and how are they important to the community. And in the second part, Alex will be asking me some questions about an actual current example of a grant that is available to nonprofit agencies like ourselves, and we'll go into more detail about that in the second part. So to begin, Alex, tell us what are public funds and why are they important? Why are they important to agencies like TTC?
So what we call public funds or grants generally is just money that can be accessed by agencies like Tarzana Treatment Centers that allow us to implement programs or services that we don't currently implement, but that there is a need for in the community. Grants can come from a number of different sources at a couple of different levels of government. So for Tarzana, there's private funding. We have grants from the city of LA. We have grants from the county of LA. We have grants from the state of California. And then we have federal funds. And that's what helps us run a lot of the programs that we offer.
Great. Yeah, there's certainly a lot of funding out there. And it definitely seems like you and your team do a lot of that searching on a day-to-day basis, a weekly basis.
Definitely.
Yeah. So tell us a little bit about some of the benefits to patients if an agency does secure public funds.
Well, I mean, the primary benefit to patients is that then they are receiving services at no cost. So that's a big incentive, not just for us to pursue these funds, but for the patient to come to us to receive services. If you don't have to pay for it because someone else is paying for it, then it's a lot easier for you to access those services at our agency.
I got it. And yeah, I would say that I've definitely I've seen so many funding opportunities out there related to providing services at no cost, and I think that's one of the benefits. So they don't have to worry about paying for those services.
Yeah.
And can you describe how the public funds impact the broader community, like in Los Angeles County, for example?
Yeah, so the impact to the community is basically that people that don't have any other way of receiving a vital service are able to receive it because there's somebody that's footing the bill for them. Yeah. So like that's the broader impact is basically like the benefit that individual has in their life and in their neighborhood. That's how the community benefits from us being able to provide services for free. And it also helps us because once an issue is addressed, then it's easier to identify issues around that issue that also have to be addressed. So it's kind of like a cycle of like, what is the problem? How do we address that problem? Now that we've addressed that problem, what is the result of that? Are things better? Now, if things are better, what is another problem related or around there that needs to be addressed in order for this community to function like optimally?
I see. And in a broader sense, can you talk a little bit about any sort of advocacy efforts or policy influences that might be impacted once an agency gets those public funds?
Yeah, well, so because we receive public funds on a consistent basis, it's easier for an agency like ours to go to funders who are like the seats of power, right? So like the government and other funders, and kind of advise them on what we are seeing in the community and what we think would benefit the communities we serve. So like it gives us to a certain extent a voice because we are trusted partners with these funders to address these issues.
Yeah, makes sense. And in terms of once an agency gets an award like Tarzana Treatment Centers, how does being awarded ultimately benefit the agency? What are some ways that they would be able to do that?
Well, I mean, primarily, I think it gives us financial stability. So if we know that we're going to have, for example, $100,000 a year for the next 5 years to implement a specific targeted evidence-based practice, then it takes a lot of pressure off of us, because we know that we know that that program will be available. And we know that we'll be able to pay our staff to provide that service. We know we'll be able to pay for the training that is required. We know that we'll be able to pay rent in our buildings. So it's that, I think primarily that's the benefit. It's financial stability. I mean, it's pretty simple.
Yeah.
Yeah, I would say that.
And are there opportunities? I guess it depends on the funder and the funding type, and then the focus of the funding that they're aiming to fund. But is there any sort of collaborative efforts that come into play? Say, for example, that maybe TTC can't do it, or Tarzana Treatment Centers can't do it all themselves. Are there opportunities that might exist for collaboration?
Yeah, it's really easy for individuals and agencies to kind of like isolate and silo. And so it's nice when a funding opportunity requires you to work potentially with partners that you aren't usually working with, or that you aren't currently working with, because a lot of the problems that we're addressing with these funds exist kind of like at the intersection of a lot of different societal issues. So for example, Tarzana, we got you when it comes to substance use disorder treatment. We do that every day. But we don't necessarily have access to food, right? So like we don't run a food bank. So if there were a program that said, okay, we're going to give you money to provide substance use disorder services, but we also need you to ensure that these people are going home with food, then we would be able to partner with an agency that provides food in the community. And then we're providing both of those services, which is something that Tarzana wouldn't necessarily be able to do on its own, and would also not necessarily think to do on its own, maybe.
Yeah. Are there potential? What would you say are the potential? Maybe if you can speak to the challenges that might come up for communicating with other organizations. I think that that might be something we. Thanks, Alex. I really appreciated learning about what the grant opportunities are and how they function and the importance of them. Is there anything else that you wanted to add that we might not have covered in terms of what you wanted the audience today to take home or to learn from both of us about maybe what the most important thing about is in terms of searching for grants, and maybe potentially any other feedback you might have?
Yeah, I think the one thing that we haven't really touched on is accountability. So like this idea that like we get these funds and then we do the work that we do, but then how do we know that it's working? How do we know that we actually did what we set out to do when these different funders give us the money? And so it's important to know that like with all of this public funding comes accountability. There's always evaluation. There's always some measuring of outcomes to ensure that like we're having a positive impact or some kind of measurable impact, so that when money is reinvested in the community, we know we have an idea of what works and doesn't work, and we have an idea of who should or should not be funded based on these evaluations. So like it's I think that what I would want people to take away is just this idea that like that public funding is vital to agencies like Tarzana, and it's important for us to know that when we receive this funding, we are accountable to the funder and to the communities we serve. And
all right, so Alex, how do you decide which funding to pursue?
So the important thing when considering funding, first, I never decide. It's a team sport. So grants goes through the process every week, as you mentioned, of reviewing funder websites to see if any funding that is relevant to the work that we do is available. And then we assess any funding opportunity that is relevant to the work that we do to see if Tarzana is the appropriate agency. So what we have to consider is like, what is our mission and how does it relate to this funding or this program that is to be implemented? Because we want to make sure that we aren't pursuing funding just for the sake of pursuing funding. So it's called mission creep. Like we want to make sure that anything that we pursue is in line with the work that we're meant to be doing, right? That aligns with our mission. Then we kind of have to consider current capacity. So if there's a grant out there that sounds perfect for us, but the goal is to do work that Tarzana currently doesn't have the staffing to do, and if there's no way for us to make that staffing happen in time for the program implementation date, then it doesn't really make sense for us to pursue that. And the other thing we have to consider is whether potentially there are other agencies out there that would be better suited or a better fit for that funding opportunity. Because obviously, in working collaboratively, we want to make sure that we're doing our part and not trying to take funding from agencies that ultimately would do a much better job than Tarzana would at a particular program.
Oh, that was really insightful. I forgot about the part where it's, especially in Los Angeles County, there's so many service organizations with different missions, different target populations, and they might be applying for the same funding that Tarzana Treatment Centers might be applying for at the same time, same funding round, all that. And it's I understand where you're coming from. It's a competitive process, but you want to be sure in terms of mission creep and also not interfering with those who are doing it so well for so long, or anything
like people that are already doing the work. And then the idea that it's a team sport, I mean, that just means that like it's not just me or the grants team that's reviewing these opportunities. It goes to stakeholders. So we send it to not only supervisors and directors within our own agency, but also out to agencies in the community and kind of go like, hey, have you seen this? Is this something that you would be interested in pursuing? Why or why not? And then that might give us an idea of whether or not we should be pursuing.
Yeah, that makes sense. And as you spoke about, when you do the reaching out, when you reach out to internal stakeholders or external stakeholders in the community that are leading other organizations, my question now is, maybe you can give us a sense of the time frame for all of this to happen. I know it begins with that funding announcement, and then, as you said, the review happens. Is there? I know we already know about the different levels of grants that are being funded. We have their local county grants, and then you've got your other private ones for maybe other healthcare organizations like hospitals and so on. And then you have the state grants and then federal grants. Are any of those? Have you noticed any of those have a specific time frame in mind when they release the announcement or they release the funding or the notice of funding, and then what's that process like? How many months or weeks would it take for, depending on the level of the grant or the type of grant, to then meet that deadline?
So I think that it's not really, I don't think it's based on funder type. I think it really has to do with the needs that a funder has identified and when they believe a program has to be implemented.
Nice.
So for a lot of federal agencies, they will forecast funding. So we'll know a year in advance that a grant is coming down the line and that we should be getting ready for it. But for some like local grants, they'll have a turnaround time of 10 days.
Wow.
So they'll put out a funding announcement, and the expectation is that you're going to have a complete application in 10 days. And that is kind of like, it almost feels like a test from the funder, because if you can't effectively submit an application in 10 days, then like potentially you're not the right agency to be doing this work.
It's their way of kind of doing the...
Well, I don't know if it is. I think it's more related to their needs, but it ends up being a test for us.
I see.
To see if we can actually get stuff in on time that's going to be high quality, that will actually get us that funding.
It's so interesting. It's really insightful, because oftentimes I know I speak with you occasionally, and we work in different locations, but the day-to-day is really focused on like the mission creep, and then trying to find the right fit. There's a lot of things to consider when an agency, a team of people applies for a grant. So that's really important to consider. Is there anything else that you think our audience might want to know related to the grant application process, or anything that we didn't cover that you've found or that you've learned since you've become a grants manager?
Yeah, I think that the most valuable lesson, and I've done a lot of training related to grant seeking and grant writing.
Mm-hmm.
And I think that the most important thing is really read the request for proposals, read the funding opportunity announcement, like go through that document. Sometimes they read like stereo instructions,
Mm-hmm.
but you really have to go through and understand. Sometimes it's a 20-page document, sometimes it's a 250-page document.
Mm.
But what matters is that you go through and really understand what they're looking for, what you need to do in order to secure this funding. And yeah, I would say that's it. Like the most important thing is like read the request for proposal, make sure that you're the right agency to pursue it, and then and then good luck getting that funding. That's really it.
Yeah, and I can imagine at all levels, no matter if it's a small one, like I said before, which is a couple $1,000s here versus multi-million-dollar one, they're all competitive in their own way, right? It just depends on, and that's something I've learned from you as I've come to know you and the work that you do for Tarzana Treatment Centers, is that they're all competitive. It's just a matter of, again, highlighting what is our goal, how we align it with our mission, making sure that we're incorporating as many people as possible in this process. And I've been fortunate to be part of the evaluation team for a lot of the grants that have been awarded to Tarzana Treatment Centers through the work that you and your team have done. And I think that they've all shown me that grants are definitely an important part of what we do as an agency and what nonprofits are, the focus of nonprofits are. Thank you, Alex, for giving us that insightful input into what the importance of grants is, and also the feedback about accountability. I think that is also an important thing that we will get to a little bit more in part 2 of our discussion today, where Alex will be asking me a few questions about a current example of an opportunity that Tarzana Treatment Centers was recently awarded, and we'll talk a little bit more about that after this. Hi, and welcome back to part 2 of Finding Hope, the Road to Recovery. Today we're focusing on grants and the grant implementation. And this part 2, we're focusing on a specific grant that Tarzana Treatment Centers was awarded. And Alex will be asking me some questions because I have a little more knowledge about that than Alex does at this point. So Alex, take it away.
So currently you're director of funding of a program that is funded through a grant that we got like 2 years ago, I think.
Correct.
Called the Certified Community Behavioral Health Clinic program.
Right.
So what
is
tell us about that program? Yeah, what is it?
Yeah, so the Certified Community Behavioral Health Program, it's a federal program. So as Alex said earlier in part 1, there are different levels, right? You've got your local, your state, or your county programs, state programs, and then federal programs. The Certified Community Behavioral Health Program, I'm just going to call it CCBHC, that was awarded to us in 2022 from SAMHSA, the Substance Abuse and Mental Health Services Administration. And what the focus of the funding opportunities that were released in 2022 was for the CCBHC funding opportunity was to really enhance and expand comprehensive behavioral health care. So what that means is, what does it mean, right? What is comprehensive behavioral health care? As I've come to learn in this new role, it is about really focusing on integrating, and therefore the comprehensive is an important component of it, substance use and mental health disorder treatment at the local level, and particularly in a clinic based, because it's called the clinic for a reason. We're focusing on integrating both substance use disorder and mental health services within and accessible through potentially different clinics across the United States. Every iteration, every program that gets funded from the CCBHC funding operates a little differently. No two are the same. What I think is important is the fact that this funding was released at a time when it was most needed. And that was the most valuable thing that I learned as I came aboard as the director. And I can go into a little more if you want about the actual services.
What does the program actually do?
Okay, so there are 9 core services, right? I'm going to list them off here. Sometimes I even mistakenly leave one out, but I'll point out a few that along the way, when I list the 9, that will really elaborate on what they're exactly, what the focus is. So the first thing and the most important is crisis services, available 24/7, 24 hours a day, 7 days a week at any time. So oftentimes that would include field work. You'd have your care coordinators and case managers. I'll speak of care coordination a little bit later on in this part too. But the second thing would be your outpatient mental health and services, mental health and substance use services. For those agencies who currently don't have that in place, coordination, as we said in part 1, is an important part. Collaborating with a community organization, if you're rural, in an urban location, suburban location, no matter where you're at, finding those key partners. If you don't have outpatient mental health or substance use services, collaboration is the key for that. Then focus of person and family-centered care and counseling, and making sure that the treatment plan that you're developing for these patients incorporates person-centered and family-centered care. And then community-based mental health services for veterans. Veterans have been served in different ways, but I think the variety of services that they're provided, there are still some gaps. The CCBHC program continues to enhance the provision of mental health services for veterans that are either not current veterans, but veterans who have been out of services for a while, or recently retired, or recent veterans who have just been discharged. So following that, there's peer family supports and counseling. The peer and family support services is also an important part of the services that CCBHC wants to employ across the nation. And then targeted case management, that's one of the important parts that are also aligned with the treatment plan. But case management is really where the rubber hits the road, where the care coordinators can effectively do case management with the patients who are in our care and say what is needed. And I'm going to link you to whatever services you'll need, and therefore the comprehensive element comes back again. And the 7th one is outpatient primary care screening and monitoring. As I said before, the clinic base is where they want it to be. Oftentimes, the clinic, it doesn't have services for mental health services or substance use services. They might have an idea where to go find them, but there's really no embedded presence in those clinics, especially if they're small and rural. And so you have to say, sorry, we don't have those services. You might have to go across to another county. It can look differently across all the states. And if you're in a metro area like we are, quite a few to choose from. Luckily, TTC is, we're an integrated healthcare organization, so we do provide a lot of those services, which we do in this list. I'll point out the ones that we were really focusing on in a little while. And the final 2 are psychiatric rehabilitation services, which are basically, if you're in an acute psychiatric hospital like we are, you're providing those services to maintain stability for those who are undergoing psychosis or mental health issues within your care. And then finally, screening and diagnosis and risk assessment. So that could be for anything related to suicidality, anxiety, or even for primary care chronic diseases. Chronic diseases are also expressed in the patient population that we serve, and on a lot of nonprofits, it remains to be the same way. I think that's the 9th is probably the most important thing that gets done daily in addition to the case management. They all kind of focus on providing, again, that comprehensive behavioral health care in those different ways.
Yeah, I think earlier we talked a little bit about how it benefits the patient to have this kind of funding available to them. Yeah. And I think this program's a really good example of that, right? Because I think so. While Tarzana was providing some of these services, before we were funded. Now it's able to provide all of these services under one roof.
True.
In like a more streamlined way, that for people that are in crisis or in distress, like that's going to be a lot easier for them,
Right.
to access, instead of having to go like all over town or into a different county, as you said,
Yeah.
to get services. Do you know how many agencies were funded under CCBHC?
That is a great question. In my experience, they have different regions. I would say there are at least 30 something, or probably more, 30 something agencies that are large in scale like ours is across the nation. We're split by different divisions within SAMHSA because there's just so many awards distributed, which speaks to the amount of funding behind the grants. If they're able to give us a specific amount for running this program for a specific number of years, you can only imagine how much funding is available if you write a great narrative and you have a great idea for a program, and they'll really help you out with that, and they're so supportive.
And then you said the program started in 2022, and how long is the grant good for?
It's good for 4 years, so we're going to wrap up in 2026. Yeah.
Wow. But I mean, that's like we were talking about earlier too, in terms of financial stability. It means that like Tarzana Treatment Centers can guarantee that they're able to provide all of these services for at least the next 2 years.
Absolutely, yeah. And I think that is a real huge benefit. Not only, I think we can speak about this in a little bit, but it reminds me of the learning process, because the implementation of one program can be different implementation or look completely different than another program. I've spoken with a lot of people in rural counties in different ways through conference calls that say we're having these challenges, because rural challenges can look significantly different than challenges for a metro organization or those who are serving a metro area or suburban, and also depends on the historic, there's a lot of history behind each of these areas and what their service needs are. So I think that's really enlightening. It's something also why I'm passionate about helping this program continue to be successful and reach those outcomes that we're going to probably talk about in a little while.
And I mean, one of the benefits, I imagine, is staffing, right?
Yes.
So like because you have these funds, you're able to employ like a variety of different professionals to provide these services for this specific program. Like what's the staffing like?
The staffing, so we have 3 care coordinators, and care coordination, like I spoke about a few minutes ago, is so important because they're going to be the people who you really rely on daily. If I'm speaking as a patient, who I can connect with and say, hey, I'm not feeling that great about my physical health, or I want to see a doctor because I'm not feeling great about this, that, or the other thing, or I need to go back into treatment, or I'm already in treatment, but can you help me figure out how to get transportation from here to there, or how am I going to make it to my appointments, or those sorts of issues and concerns can be directed to their care coordinator. So they're really important. Beyond them, though, you're going to have people that need more clinical experience. So those clinically experienced people are the ones that we've also hired on. We have one excellent clinical supervisor who has some background in providing crisis services. And so this person is leading those care coordinators to really guide them, because they might not have that experience, but they'll be able to look for those issues, look for those flags, the things that stand out to them, and say, hey, we might need to have more of a direct intervention with these people or the patients, to make sure that they are going to be taken care of and not prolonging their health concerns any longer. Beyond that, there's also an element which is really fascinating too. With this, it wasn't part of the service requirements, but it is part of the grant. The funding asked us to start implementing health information technology overhaul to our systems, and if there's a gap there, start addressing that gap by either purchasing softwares or different types of programs that would be able to address the gap. And what we're trying to do is link up our 2 electronic health record systems so we can provide that sort of continuity within both systems, because we have primary care clinic data in one, behavioral health data in another. It's trying to link those 2 up. So our health information systems, that's being supported by a data analyst. And then you've got your on-the-ground assessments that are being done regularly those get put into a system, and we need the data analysts also to put that data into a reporting system for our funders. This can look different in different levels of funding too, but for the most part, federal grants, they are making sure that they can get that data and report it to the Congress if when it is needed. And so that's an important element too. So we have data analysts as well, in addition to a director and an evaluator who create stories, make sure that create stories from the data we're seeing, and make sure that the data that is being collected is then analyzed for the outcomes, seeing whether or not there are good outcomes or if there are outcomes that we're not really fond of and we want to see more of, how we can address those. That's where the evaluator comes in, where she addresses that with the director, make sure that all the data that's being collected through surveys, assessments, all that kind of stuff will then be analyzed, discussed, and see if there are gaps and we're not really hitting our goal. Where can we go to next? What are the strategies we can employ at the care coordination level or the data level to collect more or to ask direct questions? There can be a variety of ways to address that. But that's the staffing plan that we have, and it's been working pretty well. Since I'm not in direct service and I didn't come from that background, my hats off to the care coordinators. They do a lot of great work, and so occasionally they don't get a lot of recognition for it, but it is a really important role to play.
Yeah. You've kind of talked about a lot of the benefits that the agency and the community are deriving from the program, and I just wonder if there's any sort of notion of how this funding or program is moving the agency forward. So like in the moment, it's very helpful.
Yes.
But like, can you talk a little bit about like how it helps the agency move forward?
Yeah, I think it helps the agency move forward because it really achieves, we want to achieve a higher standard. That's the directive we've been given from our senior leadership. I'm sure Tarzana Treatment Centers is not alone in leadership at nonprofits wanting to achieve that higher standard. This is a nationwide standard now, So I think it pushes us as an agency, as staff in this program, to not only make sure that we're achieving those goals, but it will allow us to achieve that sense of sustainability, as you were speaking about earlier. It pushes us forward. If we achieve that higher standard, we now know we're capable of doing that and maintaining sustainability of the program in whatever shape it might come to. We might have to pivot some staff to a new program that still maintains that same level of care coordination. We might have to pivot some staff to certain other programs, but the goal is achieving that higher standard with those newer services, maintaining it, and then along the way, you might see things, for example, this hasn't come to play just yet, but I'm sure as we get more data, we'll see through patient surveys, we'll see through patient assessments and the national outcome measures assessments that we have to do. There are patients that say, well, I'm coming from this area and it's a rural area, but I don't want to come that far anymore. Where are the services where I'm at? Then that might lead our grants management team, your team potentially, to look for opportunities to expand services in another building, buying a building and pursuing services that are located closer to the rural areas that may not be served. It could be mobile crisis, or not mobile crisis, but mobile units, mobile medical homes, or mobile units and mobile vans that address that mini clinic, or that have a mini clinic in them, and goes to those areas where they're least served or have gaps in coverage. So there's not a lot of clinics around the area. So
yeah, I mean, I can see how like the sort of like the agency with these funds, with these grants, is able to accomplish things that demonstrate that they're able to accomplish bigger things. So like it's almost like when somebody graduates from middle school or high school, from high school more appropriately, where it's like then you have a number of other opportunities available to you. Yeah. So Tarzana as an agency, if they're able to effectively implement this program, then it sort of demonstrates that they would be able to effectively implement any number of programs. Yeah. So it increases like trust and faith in our agency and in ourselves, I guess, even as employees of that agency, because we know that we're capable
Right.
of doing what we set out to do, basically.
Yeah, and I do want to bring it back to the staffing too, because without the staffing too, that nothing really gets done. I mean, you can have the ideal program, and it's really the care coordinators and then the clinical staff. If I was to lead a group of people, those are the two that stand out to me as the ones that they're doing the hard work sometimes of addressing crises, of making sure that they're being taken care of. And yeah, I completely agree with you though. It makes us feel like we can accomplish a lot with the team we have, and yeah, it makes you feel proud.
What would you say is like what's the main thing that you think you've learned as the director of this program? Like, I imagine there's kind of a learning curve, right?
There is a learning curve. I think the biggest learning curves that I probably would say is, again, the staffing too. I'm not alone in saying that it's a challenge to find the people that are most invested. You know, there are a lot of positions that we want and we require specific criteria for and specific elements. I think the part that speaks to me the loudest is we have great people because we took the time to look and to interview and to really do that work, to really get to know them and say, you think you're going to do great at this position because this is what we really need. And sometimes it's fate, and then you just kind of go with that. So that's one thing, the staffing. The other thing that I'm learning as we go forward here and kind of reaching the halfway point is they can tell you, the funder can tell you, we want to start doing this, implementing a new thing while you're doing this program. That happened to us. So now we're focused on pivoting a little bit to collect these things called quality measures. These quality measures are something that we didn't have much information on when we applied, when we received the award even. But now they're saying, you know what, nationwide standard we're going to set, and this is directed from Congress, this is directed from this SAMHSA, the Substance Abuse and Mental Health Services Administration, saying, we're going to challenge you to collect this data because we really need it. And we want to make sure that this data, not only is it going, if it's going to be collected, it's going to be quality data that pertains to specific areas of their whole health, comprehensive health, your blood pressure, not only that, but assessments for your mental health, suicidality, suicide risk, all those sorts of things. And it's an opportunity not only to grow as the agency, but also for leadership to find out the right people to call on at the right time, because I don't have a lot of information or wherewithal or knowledge about how do our IT systems work to collect this data? What are the workflows? So the growth that I'm seeing is learning how to effectively get down to who are the best people for the position in terms of staffing. The quality measures are the biggest things that I'm coming into now in terms of the challenge of meeting that and pulling on the right strings of the right people to address that and see how we can come together as a group and figure out how to make this new task that they've given to us as a grant or as a grantee to make that and make it successful.
So we've talked about what you've learned as the director of the program, but I'm wondering if there's anything you could say about what the agency has learned.
Yeah, there have been a lot of things that the agency has learned, but one of the biggest things is that the premise of the grant is correct. There are a lot of people who need these services in our community, but the benefit is actually having all the services that I discussed, the 9 services, in one place for them to receive services at.
Thank you.
Okay. Thanks, Alex. So with that, wanted to start wrapping up today. And simply put, there's going to be a lot of other videos coming up, but I hope for this one that our audience today has learned that access to public funds and grants is crucial. It is essential for not only Tarzana Treatment Centers, but other nonprofits like us in providing integrated behavioral health care and primary medical care. So that includes substance use disorder services, in addition to mental health services. And it's because it ensures financial sustainability, enhances service delivery and innovation, and reduces those financial barriers, promotes community impact and outreach, and facilitates collaboration and partnerships, ensures accountability, and it supports advocacy efforts as well. We talked about that in part 1. But overall, I hope that this conversation between Alex and I was informative. I hope you've learned something, And just simply put, the funds that are out there, they're available. And it's not just the financial resources, but it's also the opportunity for the staffing, the people, to make that positive change in healthcare delivery and policy. Thanks for joining us.
Brought to you by Tarzana Treatment Centers. You can visit our website at www.tarzanatc.org or call 1-800-996-1051.